All right. Hi, everyone. My name is Lena Tucker-Reinders. I'm the Executive Director of Iowa Public Health Association, and it's my honor to welcome you today to our third Thursday Lunch and Learn. We started this series last year, and this is our second season of doing Lunch and Learns every Thursday. It's a time where we can highlight the great work that our members are doing to the benefit of Iowans across the state. The third Thursday Lunch and Learns, as the name implies, happen at the third Thursday every month at noon. We do take a break in the summer in July and August, but we are excited that we have this year's Lunch and Learn schedule mapped out. Next month, we'll be hearing from Iowa Immunizes Coalition. But today, we are here to learn about public health dentistry from two of our outstanding IPHA members. Dr. Jessica Williams is a dentist at River Hills Community Health Center in Ottumwa, and she's also one of our newest board members. So welcome, Jessica. And Mary Kelly is a member of our advocacy committee and a great supporter of public health. She is a registered dental hygienist and does dental hygiene education across the state. So we are fortunate to have both of them with us today for the hour. This series is organized by the IPHA Education Committee, and we welcome anyone who has a keen interest in helping to provide continuing education, professional development for our public health partners across the state to join us on that committee and to help organize this series and other events, learning opportunities for our members. Just as a reminder, we dedicate this time every month to sharing our successes and even some of the detours, because we know that in all of our work, things don't always turn out as we planned it, but that they still provide great learning opportunities to share. And it's important that we do that as well. So the point of this series is to connect, is to learn, to strengthen our voice for public health in Iowa. And of course, that is part of the mission of Iowa Public Health Association, to unite and strengthen the voice for public health in Iowa. This is just one of the ways that we are doing that. If you are a member of IPHA, we thank you for that, for your membership, and your membership as part of how we are able to do this work. If you are not yet a member, we welcome you to join IPHA, and you can find the joining information at our website at iowapha.org. We are glad you're here today and hope you'll be back next month with more friends and colleagues. So as I mentioned today, we're talking with Mary and Jessica about oral health and how the importance of public health dentistry. Before I turn over to them, just a couple of housekeeping items. Your microphone is muted and your video should be turned off during the presentation. This is just to make sure that we have the bandwidth for our speakers to do their presentation. At the end of the presentation, you'll be able to unmute yourself and ask questions of Jessica and Mary. And you could also put questions in the chat room if you prefer that. So this session is being recorded, and it will be, the recording will be posted on our YouTube channel for future viewing or for those who missed the live session. So with that, let me turn it over to Mary and Jessica and let them give themselves a little bit more of an introduction, and then we'll start the presentation.
Thank you, Lena, I thought your introduction was really great, actually. I think you covered all the bases. But I do know that we are really excited to do this presentation because we really are very passionate about oral health and really champions for oral health. So we are really excited to give you guys an overview of why oral health is important to overall health, the work that we do as public health specialists, but also some of the challenges that we've seen and some strategies on how we can alleviate them. So let's talk just about why oral health is important, why we as public health specialists or people who are just interested in healthcare need to have oral health on the mind as well when we're talking about increasing access to care for all. And we're going to start with a pop quiz. So put away your books. We're just going to get a little bit, I just want a little bit of an idea of what you guys know about oral health and our oral health delivery healthcare system. Okay, so the first question, true or false? Certain medications can impact your oral health. True or false? That's the truth. Okay, most of the group And all of you guys are right. Certain medications can definitely impact your oral health. Some medications, for example, can make your gums really puffy and make it really difficult to keep your teeth clean, to keep your gums healthy. And a lot of medications that people take for different chronic conditions can make your mouth really dry. So, why is that an issue? Dry mouth is an issue because your spit, your saliva, actually has a lot of protective properties and it can help keep your teeth very healthy. And so when your mouth is dry, because you're taking medications to manage your diabetes or to manage your heart disease, then you end up, it becomes a vicious cycle essentially. And so those medications that you're taking to manage those conditions can end up negatively impacting your oral health. So essentially, it's all connected. Okay, so our next question here. Dental coverage is included in Medicare. True or false? A few more people are thinking about it. Hopefully nobody's Googling it. Stop Googling it if you are. uh, okay, couple more. Okay, I would say majority. So most people said false. And that is the right answer, but sorry, I was that professor. If you said true, I might give you points, but that's only if you really knew that some very, very small procedures are covered by Medicare. And by small, I actually mean a very small number of procedures are covered by Medicare. And that's usually in a hospital setting. It's usually something very surgical, like a reconstruction of the jaw type of thing. Nothing very routine like cleaning, checkups, or anything like that. So, yes, the answer is false. But if you knew that little, if you're like, oh, well, technically there's like one procedure covered under Medicare, I'll give that to you. Okay. Okay. And last poll. Cavities are the most prevalent chronic disease among children. Okay, great. Majority of folks got the answer right. Cavities are the most prevalent chronic disease among children. And what makes it even more so devastating is that cavities or caries, which is the fancy term for cavities, is preventable. So we're talking about the most common chronic illness among children um, can be prevented. So it really is very devastating. You guys did great with those poll questions. And so what we want to emphasize is that oral health is very important to overall health and well-being. Like we just talked about with children, when they have untreated decay, it ends up creating a situation where they're not able to go to school or they can't focus because of dental pain. So think about the social implications of that. Think about the future economic implications of that. So oral health really is important to, again, overall health, overall well-being, and it really does need to be considered when we talk about public health. Let me get this pull up the way. Okay, so just wanting to break down oral health challenges, successes among our different demographics, among different groups. Like we focusing on children again. Children we've seen a lot of strides with treating children. A lot of that is in part due to the fact that Affordable Care Act included dental care for children as an essential health benefit. I think a lot of that was driven by a case where a young boy, he was 12 years old, was unable to, his mother was unable to afford to fix a cavity, to get a cavity fixed or to get the tooth pulled. And so he ended up getting an abscess and he died from that, from not being able to have that tooth fixed. And so that really shook up the nation and it really made people who weren't really thinking of dentistry or oral health as being something a part of your overall health. It really made people realize, oh, wait, so if you have a tooth infection, you could actually die from that. So that is really something that's important to think about. So thankfully, children are covered with the Affordable Care Act. And so you've definitely seen strides, and this is what the CDC is saying, is that, you are seeing strides when it comes to untreated tooth decay in young children. But if you look a little bit further and you start to break down those groups a little bit more, you see that there are still disparities primarily among lower income children, African American children. So again, it's great. that more children are getting the care that they need, receiving preventative services. But when you start to get into the weeds of who those children are, then it brings room for another conversation about health equity, right? Now, let's think about this. If you were a child and you weren't able to get the care that you needed in childhood, a lot of those issues are following you into adulthood, most likely. And so now you're 25 or you're 44, and now you have teeth that need root canals and need crowns, and those are expensive procedures. Can you take off from work to do that? This is your working age. You probably have children, young children. Can you afford to, have a babysitter while you're getting all these things done? So you can see how it can snowball. And so adults are actually a very vulnerable population when it comes to oral health. And unfortunately, a lot of states do not cover um, adult dental care. And some are very limited. Some have great dental care plans. Others do not really cover dental care at all for adults. So it really is a very vulnerable population. And then, of course, when you again start looking into the weeds of who are the most vulnerable of that population, you see African Americans, people who are low income, people who have less education. And what's interesting is smoking cigarettes. And I really like that smoking cigarettes because I think it brings other social determinant factors into that. Why is it that somebody who's currently smoking cigarettes has more untreated tooth decay? What are the social implications of that? What are the economic? And so I really do appreciate that figure when it talks about which groups are less likely or more likely to have untreated tooth decay. So again, talking about that snowball, you didn't have dental care as a child, probably weren't able to get a lot of things done as an adult. Now you're an older adult on a very fixed income, and now you need more root canals or crowns, or now you need dentures, or you're thinking implants. Are you able to get to those services? Are you able to have transportation to go to the dentist? Do you have other chronic conditions that are making it difficult for you to find a dentist who's comfortable treating you? So it brings up so this is why older adults are also a very vulnerable population. And again, looking more specifically at the demographics, Mexican Americans, non-Hispanic Blacks, low income, less education, and smoking cigarettes have very higher rates of untreated tooth decay. And then when you're talking about tooth decay, you end up losing the tooth, right? Now, I will say that now it is changing in society and our mindset about, okay, once you become an older adult, once you age, you're not supposed to lose your teeth. Once upon a time, everybody thought, oh, just, once you get older, losing teeth is just your adult teeth is just a natural part of life. What you're finding is that mindset is going down. There are still people who do think that, but not nearly what it was before. So that's great that more older adults know they're not supposed to lose their teeth, and they know that, and they are actually keeping their natural teeth. That's great. But it's definitely still an issue, and this is still a preventable issue, which is really sad. And like I talked about, tooth loss is a vicious cycle, because if you don't have teeth, then you can't chew, and if you can't chew, you're most likely not eating vegetables, you're not eating fruits that are hard. So apples, carrots, celery, all those things are hard. And if you don't have any teeth, it's going to be difficult to eat those foods. So now you're not eating very healthy foods, right? And so that may exacerbate the diabetes, the heart disease, and it can end up causing more chronic conditions. And those chronic conditions, as we talked about before, may come with medications, and those medications may impact your oral health negatively. And it's just a vicious cycle. And again, this is all preventable. And so we really need to start thinking about how we can educate patients, educate our society, educate other health professionals about being more conscious about how all of this is connected, right? Because not only does it do our patients a great service, and makes it so they have more positive health outcomes, but it also benefits our economy. And we can think about how much money we can save if we just start thinking more holistically about the body and stop siloing ourselves off to the different compartments. And so, if I, as a dentist, can take my patient's blood pressure or blood glucose and blood sugar and say, hey, when was the last time you saw your doctor? You have coverage, or we have a medical office right here in the clinic. Or if the medical provider says, hey, it looks like you have a lot of cavities. When was the last time you saw a dentist? Let's get you connected to somebody. Think about how much time, how much money that could save. Again, if we just start thinking more holistically, right? And we can't go without talking about COVID. And COVID has created a lot of challenges in dental public health, but what we also see is a lot of opportunities in taking this situation and trying to figure out how to keep this momentum going. So it all depends on how we look at it. Some of the challenges in dental public health is advanced decay due to delay in care. So when there was a state mandate to close, and this is nationally, to close a lot of dental clinics, dental practices, and only open to emergency services, it created a huge backlog of patients um, who needed care very much so. And when you're talking about a public health dental clinic, most of the patients already have very poor oral health. And so when they weren't able to be seen, what was a big cavity already is now turning into a root canal, a crown. It's turning into tooth extractions, multiple tooth extractions. Now we need dentures. So the treatment plans are becoming a lot more complex than they were before. And this is just in a span of months because, again, of the patient population, right? And so now we're talking about more visits for the patients. So what does that mean? That means they have to take more time off. Can they get more time off? That means, can they find a babysitter? Who's going to watch the kids? The kid have to get out of school for that? So again, you have a lot of social and economic implications just because of they weren't able to get to the dentist on time. When we're talking about insurance now, again, that root canal, now that cavity can needs to be treated with a root canal, and now they've maxed their dental benefits for that one tooth, but yet they have 10 other teeth that need treatment. So it really does present a lot of challenges for our patient population. And then I want to talk about teledentistry. And even though teledentistry has been around, it's really just very recently, until COVID happened, that a lot of dentists started using, dental offices, dental clinics started using and implementing teledentistry. And I can speak for our clinic that we talked about teledentistry. Yeah, that'd be nice. But what happened was in March, we were like, oh, we got to get teledentistry started. So, there was this huge uptick in dental offices starting to try to figure out teledentistry. And that was difficult, right? But there are opportunities. And I would say big opportunity is continuing to support our safety nets. It's great that FQHCs continue to receive funding from HRSA. I would also recommend encouraging expanded functions. So really using our healthcare delivery team, so dental assistants, dental hygienists, dental therapists, which we could talk about. It's a very interesting subject to get into. Dental therapists, dentists, encouraging expanded functions, because then you can increase care for all. Also, again, supporting advanced procedures due to the delay in care. So like I said, now you're looking at bigger procedures, right, that have to be done, and especially for our adults and older adults who have much need. And there's an opportunity to continue supporting teledentistry. So again, teledentistry has already been around, but let's continue to support it. Let's continue to maintain it and encourage other places to use it, and think about how that can increase access to care for our most vulnerable populations. And like we talked about before, all of this can be prevented. And so if we support those preventative measures and think about preventistry instead of thinking more reactive, then we could do ourselves a huge favor too. So figuring out application and being flexible in how we apply these preventative procedures and preventative measures. Like, can we be more flexible about how we're able to apply silver diamine fluoride, for example, which is a magical liquid that stops cavities right in its tracks. And talk about flexibility and who can apply fluoride. Wouldn't it be great if a parent could apply fluoride on their own children during a teledental visit with a dentist? And then also continuing to support community water fluoridation, which we've seen wonderful strides in, and Mary will get into that more. So hopefully I was able to give you guys an overview of why oral health is important, why we need to be focusing on that, and how it's important to the public health work that we do. Okay, and I'm going to pass the baton off to Mary now, and she'll talk about a lot of how Iowa is doing a lot of these things and supporting and maintaining a lot of these things that I talked about. So I will pass it off to you.
Thank you, Jessica. You bring up a lot of things that I think we can have some lively chats about, more than what even this lunch and learn will let us to do. But let's get started with bringing it home to Iowa and specifics here in our state. So there's big cost of dental treatment when it happens to the very young or it goes untreated in the very served. And there's relatively low cost of prevention. Not on the slide, but in 2017, there were 10,291 emergency room visits for oral health problems in Iowa. That's 28 visits a day. So think about it, what dental treatment can be done in an emergency room. So as Jessica talked about, that there is a dental decay and it can happen across the age span. So cavities happen at all ages in here, and there's not only cavities, but gum disease. So we've got to think about the two diseases in one mouth. I mean, there's also oral cancer and things, but when we think of dental, it's mainly dental cavities and gum disease. So, and older adults are keeping their teeth even longer than ever before, which is good. You know, I say, ask the tooth fairy. The tooth fairy likes having lots of teeth, but people like having their own teeth more because of like what Jessica said, that they can eat a more variety of foods and things. So while tooth retention is a good thing, now the teeth are more at risk for decay, especially as the aging adults may lose their ability to care for themselves and perform oral self-care, or have an increased access to care problems if they end up in a nursing facility. So Jessica's question at the very start with Medicare was really important because Medicare does not necessarily cover dental. But in Iowa, and we're talking about Iowa landscape, Iowa has a very robust Medicaid system, and that does cover adult Medicaid for income eligible adults. And so there's only about 15 states, this comes and goes almost by the day, what states offer adult benefits, but we should be happy in Iowa that, that we do cover adult Medicaid for dental. All right. CDC, or I'm sorry, community water fluoridation, a crowning achievement in dental public health. The CDC called it one of the 10 greatest public health achievements of the 20th century. And so community water fluoridation is the perfect public health program criteria. It's inexpensive, it's effective, and it can reach everyone. It's essentially effortless to get. So so the first bullet sounds really good. 90% of Iowans have access to fluoridation, but what that doesn't say is the water over fluoridated or under fluoridated? And if it's under fluoridated, it's not going to be effective. So, and then looking at the last bullet, since 2015, 23 systems have discontinued water fluoridation. This is pretty alarming because of the effectiveness of it in preventing decay. So this has also led to, and I'm not going to get into politics here, but I have to mention that there is a House bill and a Senate bill. They're exactly the same. And what it's going to do is mandate a water system to notify the public and their community that they're going to discontinue water fluoridation. And it's a 90-day notice. So, and to note that if a community has too much fluoride in their water, they're already notifying their community. So if they're going to have too little or discontinue fluoridation, I think that that's reasonable. So, and that of course can be a whole nother discussion, but community water fluoridation is definitely a crowning achievement of dental public health. All right, so I feel like I'm going to tell you some good news and then some real news. But really, oral health and dental isn't as bad in Iowa as some of the other states. We do pretty well, you know, with community water fluoridation, having adult dental benefits under Medicaid. So these numbers are the first number, and why I have the asterisk. These are the most current numbers from the Iowa Dental Board on the licensees, but not everyone that's licensed in the state practices in the state. And so that chart that I included is from the Iowa Dental Tracking System. And so we're going to go with this number just for today's talking points, because the pandemic has kind of messed up with the numbers, aside from not working in the state, that a lot of dentists have retired due to the pandemic or chose not to renew their license. And I believe that there is some leeway on when they renew their license due to the pandemic, that some of that is on hold. So let's go with about 1,500 dentists and about 1,300 in private practices. So to add to the workforce and the landscape of Iowa, like Jessica works in a FQHC, that's a federally qualified healthcare center. And there's 25 dental sites that are associated with FQHCs in Iowa. And a very promising statistic is they served about 78,000 patients last year. That's just remarkable. So then there's other dental clinics that are targeted to the underserved across the state. Dental Connections and Broadlawns are both in Des Moines. Unity Point is at St. Luke's, and that's in Cedar Rapids. Their target is people with disabilities or children. The University of Iowa is kind of the catch-all. And I saw a comment about having to travel from probably Northwest Iowa to University of Iowa, because they are the main focus of where people have to go if they need specialty care, like endo, oral surgery, as well as the comprehensive care. And then there's other local safety net clinics that are around the state that don't really fit into one of the bigger categories. One thing about the FQHCs, and Jessica can maybe talk more about this, is that they might have a waiting list, and it's because they want to finish treatment plans. And that will come into play. I have another slide about that, because that's really important. It's not just getting everybody in, it's getting everybody in their chair and their treatment completed. And but they always do see people on emergency. If there is a dental emergency, they would not have to be waiting for that. Let me decipher some of these initials for you. DWP is the Dental Wellness Plan, and Delta Dental of Iowa. So those are the first sets of initials, and then MCNA, those are the two providers. Dental Wellness Plan is the adult Medicaid in the state of Iowa. Hawkeye with Delta Dental of Iowa is the Children's Health Plan, and Delta Dental of Iowa is the only provider for that Hawkeye, insurer, I should say. And then there's the traditional Medicaid, the fee for service, and that's where most of the children are in Medicaid in the state. And that is, there's discussion and momentum to move that into a more managed care and have the same providers as Delta Dental and MCNA. Then there's the provider enrollment. And remember, if we're going with about the 1,500 dentists licensed in Iowa, or practicing in Iowa, I should say practicing, then we look at how many providers the Dental Wellness Plan has between Delta and MCNA. The Hawkeye has more providers, and that's probably because they have a little bit higher reimbursement rate than the traditional Medicaid. To continue with the landscape of the providers, this is a map of all of the providers for all Iowans. These aren't just for the low income. And so, so we can see that that we have actually lost some providers over the years. And I don't know if this trend is continuing, but it probably is. But there's more shortage areas in Iowa and counties that don't have enough dentists than there are counties that do have sufficient dentists, so to care for all of Iowans. But it's not all that dismal, because there are some promising practices and things, and two of which have been going on since 2004 and 2005 respectively. This is the public health supervision of dental hygienists. This is kind of what Jessica was referring to as using the other parts of the dental team. So right now, dental hygienists with a public health supervision agreement, it's essentially standing orders with a dentist, can provide a specific amount of preventive services in limited settings. And it's mainly all the routine preventive services like sealants, fluoride varnishes, even silver diamine fluoride. So, and if they're associated with an iSmile program, they can go into any settings as long as it's covered within iSmile. So iSmile started in 2005. It is ideal companion to public health supervision. It focuses on care coordination and preventive services, such as the sealants, dental cleanings, and most importantly, referral to dentists. That's really in a big part of it with the care coordination. So this iSmile program is for Iowans that are 0 to 19 years old, plus maternal, and then it picks up again for the Iowa senior population, and that's then called iSmile Silver, and that covers 10 counties. Here again is kind of some of the good and the bad news and things. So the X marks the spot where all the FQHCs are. And this is an important map because it differs from the other one. The other map was for all Iowans, and this one is for the dentists who are accepting new Medicaid referrals. So we have found out that the number of dentists that were accepting Medicaid referrals have gone down since the pandemic. A lot of this is due because some dentists have retired. Some dentists are having trouble getting the PPE to treat patients. And then there's some pent up backup need. And so it's harder for them to get into care. So this was kind of insult to injury. I mean, I think that's understating it. But the promising news is looking at the iSmile coordinators, and many of the iSmile coordinators are on this phone call, and I think that, or the Zoom meeting, that's why I think our polls did so good. So kudos to them. Because if you look that they're not only giving the more kids are increasing their access to preventive care, but they're also getting in dental offices and getting dental work done. So here are a lot of the activities going on, but it's only some of the activities that are going on in Iowa. So the first one is Lifelong Smiles, and their focus is on aging Iowans. They have, it's a group that has state agencies, advocacy organizations, trade associations, health professionals, the dental funders, and even the academic institutes. So they've been in for quite a few years in Iowa. A newer kind of kid on the block as far as Oral Health Iowa coalitions is Oral Health Iowa. I call them kind of the umbrella organization because what they are to do is their mission is to create a unified voice among oral health champions who will educate, advocate, and integrate their efforts to improve the oral health outcomes of all Iowans. So this could actually include everybody else that's on the screen and all the other programs that you probably can think of within Iowa. So I already mentioned iSmile, and again, they go for all age groups, and there's quite a few coordinators. They cover every county in Iowa, although the iSmile Silver is a 10-county program. And there's Dental Lifeline. A lot of people know this as donated dental services. This is a group of volunteer dentists and who provide care free of charge to adults that would not have any other way to pay for care. So they're not income qualified to receive Medicaid, and they wouldn't get care otherwise. The Iowa Department of Public Health has dental screening certificates, and this is kudos to iSmile coordinators and school nurses. So it is a program that once a child is new to Iowa or entering kindergarten or 9th grade, they have to have a dental screening. The dental screening for kindergartners can be the school nurses, dentists, dental hygienists. There's a variety of people that can perform that. And for 9th graders, it can only be a dentist or a dental hygienist. So last year, out of all the school forms that were returned, there was about 8,000 kids that were identified that needed either urgent needs or dental needs. So shout out to school nurses for that, for collecting those programs and helping identify the kids. And Cavity Free Iowa is a unique program. It is coordinated with medical community, and it is to serve the 0 to 3-year-olds. And they would receive oral screenings, anticipatory guidance, and there's a fluoride varnish, a method of doing fluoride by a non-dental provider in medical practices. Here's a list of the resources that Jessica and I used to put the program together. I think we're making these slides, available for everybody. So, so we can continue on with that. Lena, it's your turn.
Thanks. Had to get myself off mute,
No problem.
no matter how much we Zoom, there's always that lag time, right? But thank you, Jessica and Mary, for all that information. I always learn something new. I will admit that, the concept of public health dentistry was new to me until I got to know Jessica and Mary, and it just all makes sense to integrate oral health into our overall health and wellness, and view the entirety of our public health partnerships from this lens. We do want to get to questions. We have about 20 minutes left for people to ask questions, and I know there's a few in the chat. Mary, you kind of alluded to one already, and that's about access to care. So one of the concerns is that, and as you mentioned, preventive care is so critical to avoiding the larger, more extensive treatment care needs. But based upon the map that we saw and experiences of many, some of the limitations are immediate access in our local neighborhoods. And the person in the chat, Kim, said that we have people who have transportation limitations, time taken off their jobs, and childcare and everything else. So, and this is an equity issue. We know that there are equity concerns all across the public health spectrum, including oral health. And so, what are some of the what advice, I guess, would you have, or where do you see some of the solutions lying in addressing these access and equity issues in dentistry?
I'm going to let Jessica answer this one further. I'll just do my first little stab. Is I think we need to keep doing what we're doing. iSmile is a great program. As I said, the results are fantastic. Getting a little political, iSmile has not had any increase in funding since its inception, and so getting funding to maintain or get iSmile back up to a level that can be maintainable is really important.
Right. And so that largely speaks to, again, a lot of this can be prevented. And that's why the focus on children is so, and that's why this focus on children is so also important, is because in the long run, we're hoping that if less children have decay that needs treated, then when they go into adulthood, they'll need less. They won't need as much as, say, their grandfather needed at that age. But so I'll say this: prevention, definite. So that's the future. That's the future solution for the generations to come, is prevention, and really focusing on how do we even stop the cavities? How do we even stop the gum disease from getting so crazy in the first place, where we have to have this specialty care? That's the first thing. Second thing is the specialty care comes from specialists. The people who do root canals, endodontists, the people who do oral, to take out teeth and wisdom teeth, oral surgeons. So those people are dentists who went into residencies. And where are those people going? Because those are the people who are the specialists who we're referring to at the University of Iowa. Those are the residents who are going through those programs. Those are the people who are able to serve a lot of those patients. So where are they going once they graduate? Are they going to California? Are they going to New York? Are they staying in Iowa? Are they going to a rural community? Where are they going? And that's the question that I'm going to pose about the situation. Where are those specialists going? Or do we need to change our academic program to where general dentists are learning how to do more specialized procedures? But there has been a time where general dentists were doing we're learning very specialized procedures, and we're doing a lot more, but now we're more so referring out, because now you have more specialists who are being trained to do those procedures. And so my question is, where are those specialists going? Are they going into public health settings? Most likely not. But why are they not going into public health settings? Well, they just spent $600,000 getting all their education. So some things to think about there. Sorry if I didn't provide a solution, but hopefully I provided the questions that can make us think about it.
Well, so yeah, we all know that posing the questions to decision makers is an important part of the important part of the process. I was on a call. I started my morning today on a call with IPHA and others talking about the healthcare workforce needs in Iowa and how do we recruit people to rural communities across Iowa, and how can we do some centralized recruiting and incentivizing and all that, and obviously dental care and oral health care, and you know, especially those with the public health lens are critical occupations within that that sector as well. I guess another question I have is, so during the pandemic, we've seen an increase in kind of anti-public health sentiment. I mean, those are my words. You know, we've always had pockets of people who are against fluoridation, pockets of people who are against immunizations. Now we have people who are against masks, and it seems that these groups of individuals or communities are kind of coalescing around public health as the common enemy, and using social media to find other like-minded individuals, and just, you know, really causing a disruption. And so I'm wondering if you're seeing that spill over into beyond fluoridation to some of the work that is necessary to, you know, to integrate oral health and the overall health and wellness, and kind of, again, that public health approach to oral health.
I think part of public health, especially well, overall, it gets kind of a misnomer by thinking sometimes, especially in dentistry, that it's for poor people. But, you know, public health measures are for everybody and things, you know, mask wearing is for everybody. Community water fluoridation is for everybody. So, yeah, I don't have a good answer other than reframing how people see, or how people more interpret what public health is.
I haven't seen any of that pushback personally or clinically from any patients. No.
Well, that's good news to share, I guess, and we'll just keep an eye on.
It's about the same. It's the same.
Right? Well, yeah, we'll have to keep an eye on kind of where activism around fluoridation in water supplies, because I know that's always kind of a hot issue for some.
And
so
Lena, I do want to point out that the legislation isn't to change the water fluoridation. It's really just to give the community notice and things. So, but we will have the anti-fluoridationists out there, I'm sure.
Well, and absolutely, because I mean, part of, as we all know, education is critical in so many areas. And if you're relying on water fluoridation for your oral health, and that stops, and you're not aware of that, then you know, there's potential problems with that. So we have another question that's come in from the chat. It says, with over 55,000 residents living in Medicaid nursing facilities, what is the plan to reach this population with in-house dental hygiene services?
I think the teledentistry is going to be big, as well as public health supervision. So, and this is kind of my population of focus right now is elderly people, especially ones that can't get out to the community dental offices. So it's really difficult to, there are rules right now and laws that do allow hygienists to get into the nursing facilities. It's just, I guess, maybe even educating our own workforce, the own dental hygiene community, that this is something that they can do. Paying for it is another thing, because it's really toothbrushing is what they need. From my, I've done research in nursing homes, and one of the studies was that I would go in and brush people's teeth, and then I'd go, and that was every 2 weeks. Well, I can say that I was probably the only one that brushed their teeth, and it was every 2 weeks. And so I don't know how, and I've heard this from colleagues that go in and provide preventive care and actually do dental cleanings, but it's the day-to-day care that's really the important part. And I think just empowering the direct care workers and supporting them. There is a program called Mouth Care Matters that goes into nursing facilities, but again, funding and educating, and then finding the time for these direct care workers, especially now with the pandemic. So much is they're relied on so much, and there's so few of them being stressed at every level.
And when we think about, because you can think of it two ends of the spectrum. Children, oh, we're going into schools, easy, and we're providing these preventive services. Let's just do the same thing for nursing homes. Like we talked about, older adults have a lot more complicated needs. They need, again, those root canals. They really need fillings. They really need dentures. Whereas children, really, maybe they need a cavity filled, or they just need, or maybe a tooth pulled or something. But nearly, when we're talking about clinically, the amount of work that's needed, that's what also makes it really difficult. So the preventative measures can only go so far for somebody whose oral health is already very poor. So then you're talking about, okay, is it just about maintaining things? Is it just about maybe applying silver diamine fluoride and just stopping the cavities where they are to make them more comfortable? So that's why it's so challenging to figure out how to serve older adults where they are, especially in nursing facilities.
So on a related note, I know that there's a push for community health workers to kind of be that first liaison to the healthcare community, and it helps people age in place and everything else. What do you know? Are community health workers trained in things like teeth brushing? Is there limitations? Are there barriers for that? Is that considered an invasive procedure?
Actually, there is a grant that is going to educate community health workers on oral health. So it's going to be implemented probably this spring. And toothbrushing is not covered by, it's not the practice of dentistry, so anybody can toothbrush anyone else's teeth.
That seems like a great resource and opportunity to meet some of those needs, especially for people that are perhaps homebound, need care but aren't in a care facility. And an overall point of wellness for people. So I'm glad to hear that's going. Let's see. There's another comment in the chat, again, about fluoridation legislation, and it being that this legislation, even though it's not a bill to amend the fluoridation levels, but again, the public announcement, but it does provide an opportunity for not just, I would add, not just dental health professionals, but public health professionals in general, to provide that evidence-based information about why fluoridation is important. Mary and Jessica, I think between us, we can definitely, we should put together some kind of post, social media, fact sheet, whatever. I'm sure you guys have plenty of information that we can make accessible to our public health partners across the state to aid in that education. I guess it wasn't really a question, was it?
We've started that actually on advocacy committee, which I serve on. So.
Great. We have just a few minutes left, about 5 minutes left. And if anybody would like to unmute themselves and ask a question directly, feel free to. I just want to scroll through these comments and make sure we haven't missed anything.
I think one was the videos.
Yeah.
Off the top of my head, I can't think of any videos, but we can definitely get back to you about some resources. Like I said, I'm kind of drawing a blank right now on videos.
Also, I want to, and I know there are some videos out there, but also I want to point them in the direction of their local I Smile coordinator, because they're getting pretty innovative at how they're reaching kids, especially with schools. So give them a chance to either suggest a video or to maybe do as a presentation. I'm putting them on the spot. There's lots of them, so don't shoot me. But I think that's kind of what they wanted. They're looking for ways to connect with the community. Oh, there you go.
Looks like Kathy also noted that the University of Iowa also has some resources, some good educational videos. So thank you for that.
Lena, this is Cheryl Jones. I work with Child Health Specialty Clinics. We see kids with special health care needs, disabilities. And the conversation about lack of resources in general for dentistry is quadrupled for this population. Some dentists, even if they accept Medicaid, they won't see kids with autism. They don't see kids with significant special needs. So it is an incredible challenge. The other thing is just the day-to-day hygiene for these kids. Many of these kids are very orally sensitive. They don't want anybody brushing their teeth. Trying to even look in their mouth is a challenge. And Jessica, I so appreciate River Hills Dentistry. You see so many of the kids that come in my clinic, and I so appreciate your care. But a number of these kids do have huge dental problems because we have kids who are 8 years old and still can't eat anything but formula. And so I think that's another issue that we really struggle with, is services for these kids with significant special needs.
Absolutely. And I think that largely has to do with what dentists are taught and how they're taught to treat special needs. I will say more recently, a lot more programs are recognizing that dentists do need to be more competent in treating special needs populations, because really what it is that you just defer to somebody else because you're like, I'm not sure if I can do this. But I can say, like, in my dental program, we definitely had opportunities to treat people with autism and special needs. And I know dentists who are coming out of school have had those experiences. And I will say a lot more dental programs are making that a priority to make sure that students are having those experiences and learning more about it. So hopefully we can do a lot more to help treat those populations. And again, thinking about how we can be a little bit more creative in how we treat those populations. Like I said, silver diamine fluoride is a great resource, and that can again stop the cavity where it is, keep it from getting bigger. It doesn't fill the tooth, but it's something. So again, thinking about some of the different ways that we can use our preventative services. Mm-hmm. And just and how we deliver those procedures in a different way. So it takes some modifications. Maybe, this appointment won't be as straightforward as you're used to. Maybe, things will be a little bit different. Maybe you let the child allow themselves to, explore the space a little bit more, and that takes time. So also, again, being very creative with how you treat the patient directly, and making those modifications. So learning about those things. But it's a huge need, absolutely.
One of the resources I shared with my own dentist, because I asked if I was referring kids and said, will you see kids? Autism Speaks has a really good guide for dentists for dealing with kids with autism. And I actually took that information to my dentist's office, and they said, one of the hygienists said, we all read it because it was so helpful. And they are now following some of those kids. So I think for those of us, we have something on us too, as providers who are dealing with these kids, to share resources. But that's a very good resource that's available for dentists, specifically for dental visits for kids with autism.
I can put together a list because I did some work with Easter Seals of Iowa. So I put together a couple presentations and a resource list that I'd be happy to share too.
Well, thank you, everyone on the call today. Thank you, Jessica and Mary, for highlighting the work of public health dentistry in Iowa in the future. And it looks like there's strength in, as with every program, there's strength in partnerships, there's innovations in education that's coming along, and that's really promising for the horizon of public health dentistry and oral health in general. So again, I want to thank everybody for joining us and spending your lunch hour with us today. Just a reminder that the IPHA Education Committee is, while we have all the sessions planned for this year, as you can see on the screen, we are now opening it up for IPHA members who would like to share their programs in a lunch and learn for the 21-22 season. So please do contact us if you would like to share your work, and especially if you would like to help us in the planning of these sessions and joining the education committee. Just another reminder that IPHA is a nonprofit organization, and we do rely on membership dues and sustaining donors to support our mission of uniting and strengthening the voice for public health in Iowa. If you are not yet a member, please consider joining IPHA. You can find information at iowapha.org. Students, if you're a student on the call, check with your faculty advisors, because there may be funding available through your college or university to support your membership. And we do have limited student scholarships available as well, thanks to generous members who have donated to that effort. If you are a member, thank you, thank you, thank you. We appreciate your membership, your advocacy, your dedication to public health, and we also appreciate any donation that fits into your budget. Just as another reminder, recordings of all of our Lunch and Learns will be archived on the Iowa Public Health Association YouTube channel. We'll get this recording up there as soon as we can, and you can check out ones from from earlier in the series. Thank you again, and we will see you next month on the third Thursday at noon, when we will be talking all about immunizations and highlighting the work of our relatively new Iowa Immunizes Coalition. So we will see you next month.